Welcome to DIYPRP. In this video, we're diving into a key factor that determines the success of platelet-rich plasma therapy, platelet activation. Understanding how, when, and why you activate platelets can dramatically affect treatment outcomes, especially when you're working with leukocyte-poor PRP for joints or leukocyte-rich PRP for muscle and tendon injuries. Let's break it down. First, what exactly is platelet activation? When platelets are activated, they release their growth factors, things like PDGF, TGF-beta, and VEGF. These are the molecules that drive healing. But here's the catch: how you activate them changes everything, including how fast those growth factors are released, whether a fibrin matrix forms, and how much inflammation is triggered at the site. There are four main ways to activate PRP: physical, chemical, thermal, and ultrasonic. Physical methods include needle shear, shaking, or centrifuge shock, all of which apply mechanical stress to partially activate the platelets. Thermal methods like mild heating or freeze-thaw cycles push platelets to rupture. Freeze-thaw causes full lysis and uncontrolled release, useful if you're making platelet lysate, but not ideal for injections. Then we have chemical activation, the most common in clinical settings. The main options here are calcium chloride, calcium gluconate, thrombin, and occasionally collagen. Calcium chloride triggers the clotting cascade and platelet degranulation. It's strong, reliable, and often used for intraarticular PRP. Thrombin, especially autologous thrombin, is the most aggressive. It causes near-instant platelet activation and builds a fibrin matrix, ideal for soft tissue healing. Calcium gluconate is milder than calcium chloride. It activates platelets more slowly, leading to a gradual release of growth factors, which turns out to be a key advantage in certain joint applications. Finally, ultrasonic activation, though less common, uses acoustic waves to stimulate platelets without any chemicals at all. So which activator is best? That depends entirely on the clinical context. Let's start with leukocyte-poor PRP for intra-articular injections, like in the knee. In joint spaces, blood flow is limited, healing is slow, and precision matters. Here, calcium gluconate is often the best choice. It matches the slow healing timeline with delayed activation kinetics, ensuring a sustained release of growth factors over days, not seconds. Alternatively, some clinicians skip activation altogether, injecting PRP in its resting form. This relies on native collagen in the joint to activate platelets in situ, offering greater spatial precision, releasing growth factors exactly where they're needed, not in the syringe or synovial fluid. In both cases, minimal fibrin formation helps keep the PRP injectable and allows for better distribution throughout the joint. One more point: when using non-activated or slow-activated PRP in joints, multiple injections are often superior. Since the healing process is gradual, repeated doses maintain therapeutic growth factor levels throughout cartilage repair. Now let's look at leukocyte-rich PRP for muscular or tendinous lesions. These tissues benefit from immediate action, fibrin matrix support, and inflammatory recruitment. Here, autologous thrombin is the best activator. It gives you rapid, complete activation and a firm clot to support tissue adhesion and hemostasis. Calcium chloride is a viable second option, slightly slower, but still effective. If you're making a topical gel or platelet lysate, freeze-thaw may be appropriate too. Avoid leukocyte-poor PRP in this context. You want the leukocytes and the strong inflammatory signaling that comes with leukocyte-rich PRP. Let's recap. Choose your activator based on your goal. For joints and intra-articular leukocyte-poor PRP, go with calcium gluconate, or consider no activation at all for in-situ precision. For soft tissue repair with leukocyte-rich PRP, use autologous thrombin for rapid action and strong clot formation. These choices aren't trivial. They determine how fast healing starts, how targeted your therapy is, and how the tissue environment responds. If you want to go deeper, check out the full written breakdown on DIYPRP.com. And if you're building your own system or training others, stay tuned. More advanced protocols and video guides are on the way. Thanks for watching.